All right, I think I will get rolling here. We've got a lot of really fabulous information and discussion planned for today. So we'll make sure that everybody is seated and ready to go. So I want to welcome you to Health Hour Live. My name is Leslie McGill. I am the CEO at MedicAlert Foundation Canada. This is the first of our 2024 Health Hour Live webinars. And I am really excited to be kicking off this season with an important subject, health system navigation. And surprisingly for many, navigation is not really that new in Canada. It actually began in Nova Scotia about a decade ago, maybe a little bit longer than that. But sadly, however, health system navigation is not necessarily widely available through the public healthcare system. And joining me today is my new friend and great partner, Jamie Marcellus, President and CEO of Novus Health. Jamie is a nurse by trade, but a longtime CEO working in the health tech space and many other very interesting places. We won't get into a lot of that detail, Jamie, today, but welcome to Health Hour Live.
Thank you very much. Thanks for having me.
Happy to have you here. Now, it was amazing. We've had a number of people register for this event, a surprising number, more than 300, and that's really exciting. That tells me that people are really interested in health system navigation. But we also asked our registrants to share a few questions that they might have of you and I, and what a range of questions we got from what the heck is health system navigation? Where do I access it? Do I really need it? Can you help me find a doctor? And down to something as specific as I have a specific health condition, what do I do? So we can cover the gamut of sort of a broad ranging topic. We can't speak to individual health issues here today. That's not what this is about, but it really is designed to help you to understand what the benefits of health system navigation are all about. So Jamie, my first question is really to sort of lay the land or the framework for why MedicAlert and Novus Health decided to partner on health system navigation. So what I'd really like to begin with is what actually drove you as a nurse in that background to gravitate towards leading an organization that does health system navigation? What was it for you specifically?
Yeah, so I think it's a great question. At the risk of aging myself, when I graduated nursing school in 1999, a lot of the same issues that we face today were in fact happening then. We had challenges around human health resources, individuals, shortages of staff. There was challenges around wait time, complexities like at the time I came through was SARS, recently was COVID. And so really the biggest change probably over the last number of decades has been technology and things like that. But in terms of a lot of the existing challenges that have been going on, they've been here for a long time. And so I've known about Novus. Novus was founded in 2006. And I was always exceptionally interested in the work that we do here, which is really trying to help individuals have a better experience when it comes to their health, recognizing that the challenges that I just described in terms of just the complexity and sort of what's going on with the healthcare system.
So complexity is a bit of an understatement when it comes to the Canadian healthcare system. We were chatting the other day about how complex it actually can be, and hours of conversation is devoted to this topic in this country. Sort of some of the big headlines more recently are around physician availability or lack thereof in many provinces, or issues of transfer payments from the federal government to the provincial government and who exactly owns what. So one of the reasons that I want to start sort of at the big macro picture is to help people get the lay of the land, because not every province is the same. Not every access point is the same for healthcare in the country. So why the heck is it so complicated?
So it's funny. It's not funny, but it's funny. I saw a meme just the other day posted that sort of, I'm going to probably not get it quite right, but something to the effect of, we've put people in space, we've put people on the moon, but we can't solve healthcare. And so when you think about the complexities that are involved in space travel, or whatever it is, I imagine it's exceptionally complex. And the fact that we haven't been able to solve healthcare in a big way, I think, just reflects the complexity. Specifically within Canada, I think you have a number of reasons why, but first and foremost, the way that the healthcare system is set up is relatively complicated. So while we have universal healthcare, a single payer, in terms of the sort of overarching model, it's a little bit more complicated than that, in that the federal government has decided, through legislation through the Canadian Health Act, to sort of dictate what is covered and what isn't covered, provides payments to the provinces. The provinces also have to raise or include dollars into the funding. And then I think the overarching thing is that legislation is a sort of nebulous. It's a living, breathing document, and so it's up for interpretation. And so each province, though many of the principles remain the same, in terms of some of the finer points, interpret things a little bit differently. And a great example of that is, Quebec has a little bit more leeway when it comes to private physician services, by way of example, just by how they've interpreted and continue to utilize legislation. I think the other misnomer, or maybe misunderstood aspect of Canadian healthcare is not all of it is publicly funded. And so about 2/3 of the, roughly speaking, $300 billion is raised through taxes and provided by the federal governments in various provinces. About 1/3 is paid for through things like private health insurance, employee benefits. And so a great example of that is medications. Medications make up a huge part of healthcare. And in some instances, they are covered by provinces or covered federally. But in other instances, the employer is expected or you're expected as part of employment to have access to benefits to be reimbursed for that. And so I think you put that all in the blender, and it's exceptionally complicated to know where to stop and start, especially if you're having something like a diagnosis or you're trying to find your way through healthcare. The other thing is, I think there's regional variations. Some of the provinces have a regional model, some of them have a centralized model. We are a massive country from a geographic standpoint. And so, there's differences in terms of rural, there's differences urban-wise, in terms of what's available, expected level of travel. And so I think I could keep going and going, because it just sort of highlights the fact that there is this complexity to the Canadian healthcare system.
So you and I both know we've worked in the system a really, really long time, and it is highly complex. But when somebody's facing a new diagnosis or a change in their health status, for example, if they've been managing a condition for a really long time, that political spectrum kind of gets tossed out the window. You don't really, really care at your core about how the government is funding healthcare and why is the service available, or why don't I know about that service. You care about getting help. But what you've described is a system that can be highly complex to navigate, hence the word health system navigation. And people aren't really, really comfortable asking all the time about what is available to them, or how do I advocate for myself. I need to trust the people that I'm working with in order to be able to get the answers that I need. But if I take a look at some of the questions we got, it doesn't always kind of flow that way very easily. They might get resistance. They might get a mixed bag of answers to the same question. Friends might refer them one way and doctors might refer them another way. And it's hard to really be able to understand what is the most effective course of action. So now that we understand that complexity, not that we've solved for that problem, and we won't get that done today, but we can work on it. What is it about health navigation that is helpful to people? Maybe we can start with a broad definition of what health system navigation actually is and what it's not, because I think that's also helpful.
Yeah, so I think it's one of those things that I think, depending on where your position is or what your relationship with health or the healthcare system is going to vary a little bit. But at the end of the day, what a navigator's role is to do is really to support that individual and make their experience with the healthcare system or with their health concern better in some way. And so if you can imagine, for someone who has no experience with the system, no knowledge of health, that's going to be very different than somebody who has maybe gone through a few things either individually or with their family, but needs some help in understanding what options are available to them or how to interpret a certain set of information and things like that. And so really, ultimately, the navigator's job is to understand where that person is in their health journey, try to meet them at that place, and then add value along the way as they're continuing to go through it. I think in terms of what we're not as navigators, we don't schedule appointments for individuals, because then we're into managing calendars and it becomes really inefficient. The other thing that we're probably, everyone should understand, is the navigator's job isn't to give you advice per se, in terms of here's what you should do in this situation, but rather to give you a whole host of options so that you can be ultimately as informed as possible and make the best decisions around your care. Because, every individual is going to have a different perspective depending on what's important to them. Those are probably at the one side, the definition, and then on the other side, the things that probably were not are key to their role as a navigator.
So I think that's really helpful to sort of make those comparisons, because the other question that we have been asked about Health Navigator, our new program that we've launched with your help and support, is so who are these people who are going to pick up the phone? What are their credentials? And so I want to make it clear to the people on the call and our members as well, is when you call in, if you register for Health Navigator, you're not calling into the call center that you've been used to calling into for many years. This is a very different set of individuals with a different set of skills. And so help us to understand who's on the other end of the phone.
Sure. So our health information specialists are the individuals that that individuals would connect with. They make up a wide range of backgrounds that are health focused. So some we have as nurses, some are mental health specialists, some are nutritionists, some are social workers. It's sort of a mixed mixed bag in terms of the experience of the individuals. But I think the most important thing is, first of all, they're Canadian, and they handle literally thousands of situations of people's health on a daily, weekly, monthly basis. And we've been doing this since 2006. We do provide support for individuals on very small concerns from a relative standpoint, straightforward things to very complicated things and everything in between. I think the important thing to note is that the individual that is being connected with, their job is to demonstrate care and support for whoever that member is at the other end of the phone, to ensure that their questions are answered, that they have knowledge, and ultimately, as I said a few minutes ago, that from a value standpoint, they're getting more value out of their experience than they would without us. And again, that's going to look very different depending on the situation, depending on the individual. But it's our job to really support those individuals.
So that's actually a good segue, because you're talking about individuals with lots of incredible skill sets, but no two provinces are alike in this country when it comes to health system navigation or any healthcare system discussion. So what are the biggest challenges or questions maybe that your navigators get asked? And is there a regional disparity in those kinds of questions?
So regionally, I would say at a high level, the types of questions are fairly common, and they range from resource identification. So roughly speaking, about a third to almost 40% of interactions revolve around somebody trying to identify a healthcare professional. They need a family doctor, they need a mental health specialist, whatever it may be. And then moving along beyond that, we get into much more specific things that tend to fall around sort of diagnosis or broad healthcare challenges. I am a caregiver and I need to sort of manage the caregiving situation on behalf of. I've been diagnosed with cancer. I've been diagnosed with diabetes. How do I manage that? What are the steps that I need to take? But that tends to be the reasons in terms of the experience that and the information that's being provided back. Certainly, there's some consistencies when we're explaining what a diagnosis is or what various medications are. Those are fairly consistent province to province. There's sometimes some nuance in terms of what's covered. Things like access. How do I access specific aspects of care? Can be very different. Province to province, or sometimes even within the province, as I said before, because of just the geographic makeup, there are some differences rurally or into big centers. And then when you get into sort of the healthcare professional side of things, where we're trying to find resources, it's very vastly different in terms of the experience. And that can be in province. So in Ontario, where I live, particular areas are really challenged from, family doctors, for instance. Like Ottawa, currently, for whatever reason, the Ottawa region is very challenged to find family doctors. The Greater Toronto area, it's not as challenging. You can cast your net fairly wide, but if you go a little ways outside of the GTA, let's say Barrie, there's lots of challenges. And so again, it's just trying to understand what that is and giving the individual the best possible piece of information that they can to help manage their care. I don't know if I answered the question exactly.
You did. It's great. And I'm super curious as to how you keep on top of things, because things move at lightning speed or a snail's pace in the healthcare system, depending on what part of it you're talking about. But from year to year, programs come and go. So how do you manage to stay current so that you are actually giving people accurate information? And you don't have to give away the secret sauce, but maybe a little bit of insight might help us.
So the common one is, well, how do you find family doctors? We read them in the headlines every single day. There's a shortage of doctors. There's all those sorts of things. So first of all, a bit of myth fact. The number of doctors per capita is actually higher than today than it was in the 1970s. So on a per capita, on a population basis. Now, that doesn't consider complexity of care. That doesn't consider geographic disparity, all those sorts of things. On a pure individual to individual basis, there's more doctors. But those doctors are working differently. And so as a result, we have what I just described a minute ago, which is shortages and things like that. And so the question that I often get is, well, if there is this shortage, where do you find family doctors? Mm-hmm. So I would sort of tongue-in-cheek say the place that you find them is the last place you found them. Meaning, because we do this so much, we have oftentimes a pretty good understanding of the good places to look. And then I think the second thing is our team is pretty relentless in terms of trying to go through the process of engaging and understanding whether a physician or a nurse practitioner is accepting patients, to the tune of, I think recently we made something like 80 calls. I think on the Ottawa example that I just gave a minute ago, we contacted 80 different healthcare professionals to try to find multiple options for an individual, because we're always trying to find at least more than one. I think if you said, well, I could do that on my own, you could for sure, but you might have stopped at maybe 3 or 5 or 10. Our team can just go to 80, and there's two important reasons for that. One is obviously the information that we can give to the individual that we're trying to support. It's really critical that we're trying to help them, and so we want to help them. But second, going back to my point I made a minute ago, it helps us for next time, because as we're making those connections and engaging and tracking that information, it allows us to then get to that a little bit quicker in terms of what that is. When we move beyond, specific examples of resource identification in terms of how the system works, or what's changing in provinces, we're constantly researching, we're constantly adding to those things. We have guidance from our medical director, we have guidance from our team of nurses, and we're sort of putting that all in the mix, and really trying to track it. And to a certain extent, sometimes it's because it does change sometimes fairly frequently. We're updating it as we go in terms of engaging and understanding and asking the right kinds of questions and feeding that back into our databases, so that for the next time, we can get to the answer a little bit quicker in terms of providing that back to the individual.
So, and that's what you do day in and day out. For those of us who even are well acquainted with the healthcare system, I wouldn't have gone to 80 people trying to find a physician. I would have driven me crazy. I don't have the time, nor the inclination. And I think that's really one of the things in terms of barriers to care, is because the system is as complicated as it is, or it's hard to essentially follow that particular path, because you might not necessarily know even how to get a hold of 80 physicians other than trying to Google and see what happens. So it's nice to be able to have a group of individuals who are focused on that specifically as their day-to-day job and their specific task, among many, many other things. You talked a little bit about things other than resourcing, and one of the things that happened to me not too long ago, so all things bared here, is I had hip replacement surgery about 1.5 years ago. Great facility, great physician, great access, no issue there. But as I was referred into the clinic, I learned about something that my GP actually had no clue about, which was rapid access, which is a program here in Ontario for hip surgeries specifically, and I was eligible for that. But I learned about that through the physiotherapy part of my appointment, where she said, actually, you qualify for this particular program. Had I known that sooner about what was available, as I was sort of considering, do I or don't I go for this surgery? I'm young enough where I started to question that. Should I wait? Should I not wait? But had I known, and I'm grateful that I actually had eligibility into that program, but I might have been able to ask better questions sooner, because I got caught in the COVID conundrum of all of this as well. So how about those kinds of things? How do people make themselves aware of programs that they wouldn't even know how to ask for, or that are even out there? How does that kind of dovetail into the navigation system? If somebody calls for something, would you then extend another possibility about what's potentially there for them?
Yeah, so and I think obviously each situation is different in terms of what's going on with the individual, what's available. But I think part of the job of the navigation team is really to engage that individual in a conversation about their health, what they're trying to accomplish, what they're looking for, and also to provide some knowledge around not just here's what something means, but here are good questions to ask of your healthcare professional. While we are healthcare professionals in the broadest sense, we're not providing care to you on an individual basis. There's still reliance on, doctors, nurses, physio, all the healthcare professions that you would. But if you can have a better conversation with those, with your family doctor, in the case that you described, maybe it would have had the same outcome, but maybe you would have gotten to the information a little bit quicker because you would have been set up to start asking the right kinds of questions. So those questions can be, what's next? What's an optimal outcome for me? What are the treatment options? How does it work? Where can I go to do this? Is there another way? That's always a good question, is there another way? I think one of our great questions that we have individuals ask their healthcare professional is, what is the question that I should have asked you that I didn't ask you?
Yeah.
I think it's a great question to seed for that individual, so that when they're having a conversation with their physician, with their doctor, that doctor understands that they're there to help. But I think, we provide this additional support for that individual so that they can kind of bounce ideas and, understand if there's other options, or, try to unpack something. If something was mentioned and they don't know what that is, like, what does rapid access mean? I'm not sure what that means. Let's figure it out and give you that information back, so that, again, number one, you have a better understanding, but more importantly, you can make more informed decisions as you move around from.
Absolutely. When we were thinking about launching Health Navigator, we did some research across our subscribers. And one of the really interesting pieces of information that came back for us is about understanding test results, which you would think would be sort of an easier thing to understand. So why do you think that came back maybe as a place where people really need some help, based on your experiences of working with your team and the questions that they get asked?
So I think from that standpoint, whenever you're interacting with the healthcare system, you're going to tend to have something done in order to help with the diagnosis of whatever's going on with you. Mm-hmm. And all of a sudden, that results in words that people don't understand. If it's blood work, what does ranges mean? What is this that's elevated? What does that mean relative to something else that's maybe low? And so generally speaking, I think people have an awareness of that. Number one, a test has been done, but second, whatever the high level results are, but they don't have a way to interpret that, because oftentimes, and it's not, I don't mean this to be a criticism of, physicians, nurses, those sorts of things. They're exceptionally overtapped, and so they don't always have the time to spend talking to the individual. At the same time, the individual in that moment, in that office or in that consultation, may not be in the right headspace to start asking questions around that. Mm-hmm. And so, you bring all that back, and I think it results in lots of people having questions about ultimately, what does this mean? And so we do spend a lot of time, not so much interpreting the results, but explaining what things mean. Why, while this is slightly elevated, the doctor doesn't seem to be concerned about that, but this is low, and that's why they're concerned relative to what's going on with the individual. And so we're sort of there as almost like a Rosetta Stone, mm-hmm. In terms of interpretation of some of the more complex lingo and languages that we use in health to really help that individual understand what's going on.
So you touch on something in that answer that I find really fascinating, which is about not being in the headspace as a patient to receive information, especially if you've got a recent diagnosis or something that's fairly complex or something new that you're trying to understand, and it takes you by surprise. But oftentimes I've seen people just sort of say, I'm going to sit back and not take any action, but then get worried. So why do you think people are hesitant, and how does health system navigation, in that broadest term, but that much more specific conversation, how does it help people to overcome potentially the stigma that they might be feeling, or I don't feel like I want to question my physician about this. I don't want to even understand it, but I do, sort of that dichotomy that people experience. What does it look like when people call, when they have this sort of hesitance maybe to actually ask a question that could really help them?
I think the one thing is, obviously the individual that they're speaking to is exceptionally caring and is trying to understand what's going on with the individual, what they're hoping to understand. And I think the best thing that we have available to us is time. Again, oftentimes in that moment, the individual feels rushed. They feel like maybe the healthcare professionals is rushed because of whatever's going on in that environment. And so they don't want to put that person out, or they don't want to seem, that they don't know what they're talking about, and we just allow that space to be able to have that conversation. What I would say is one of the best pieces of advice that we're often giving is when an individual is going through a complicated health situation, it's always good to have somebody alongside them, if possible, during some of the more challenging conversations about maybe what is the diagnosis or what are the treatment options that the individual is faced with, because you get into this sort of tunnel of not hearing everything, or only hearing maybe every fifth word, and having somebody that is there that can take notes and sort of replay back to the individual what it is. And then ultimately, if they have access to services like ours, feed that back into the navigation rule to really then start to make sense of what's going on with the individual, because then you're working from a place of generally really strong facts that you can start to manage information against and provide a more detailed understanding, so that the person can get to ultimately decisions and the sort of right pathways for them from a care perspective.
It's a really great piece of advice. We don't often invite people in to having those kinds of conversations, but they can be really challenging, and different perspectives can really help drive your choices, because ultimately this is about choice in the end, and sometimes people don't feel like they have a lot of choice in our healthcare system.
Well, I think the key of that one is to sort of be prescriptive to whoever you're bringing along, which is, I don't want you asking questions, I want you documenting, I want you taking notes. You're here to be my ears, because I'm not going to hear a lot of things. And I think if you can frame it in that way, that individual, hopefully it's a trusted person, you feel really supported from them, they'll take good information that then you can utilize in the future.
So just for people who are on our call today, can you describe what a typical call would look like? What walk us through the process of what one would look like, because that's a big question that we've been asked. So what the heck is this, and how does it all work?
So there is nothing typical.
Okay, well, we'll start there. Yeah.
So there's nothing typical, because each individual is coming with their own perspective as well as whatever's going on with them. We have sometimes individuals that have very basic questions. What does this mean? Also maybe very basic understanding of sort of the broad system. We have other individuals that come to us that have really good knowledge, but maybe not in a particular area, and need to sort of help focus and work through that. But generally speaking, obviously, what our team is there to do is really to start to make a connection to that person, start to have a conversation with them. Obviously, it's understanding some of the big questions, which is, where are you in the country? What's going on? What are you hoping to understand? And then from there, we generally don't have a then B script that we're following, because we want it to be conversational, to feel normal and feel, that you're feeling engaged, and allow our health team and the individual to follow the conversation wherever it may go. Now, there are things that we want to capture in terms of, common things that we want to understand from that person's health, so that we can make better information available to them as we go through it. But it's sort of a much more winding path that we're taking that individual through, and gathering that information as we go. And so generally speaking, calls range from, I'd say a typical call is 15 to 20 minutes, but it can go up as much as an hour to 2 hours. And then I think it's important to understand that it's not a single call in most instances. That first call is a bit of a fact-finding mission, where we're getting some information, and then we may be doing something. Again, if it's basic things like going to identify healthcare professionals, it might be that. We may be putting together a sort of package of information to give that person back as sort of a guide to what's going on, and then everything in between. And so commonly, we'll have a couple of, maybe 3, maybe 4 conversations with that individual over a period of, a day to a week to 2 weeks. And then we want to check back and make sure that that person's well supported, that they, whatever we recommended in terms of steps A through Z, that Do they have any questions? How's it going? Has anything evolved? Can we help with that? To make sure, again, that the person's really supported. And I would say the best feedback that we often get is less about the information that's provided, which is still great information. It's more about having that caring individual on the other phone really feel heard, feel supported, to ask questions, to get answers on things that, again, they may not have felt comfortable asking in that doctor's office or hospital or other healthcare professional, whatever.
Exactly. We get a lot of very similar comments about our medical staff as well. And that's one of the things I want to make sure that people do understand at this stage of the Health Navigator service that we provide, is that your team doesn't have access to the MedicAlert record. A lot of that has to do with privacy legislation and sharing of information. And at this point, we don't have permission from our members and subscribers to share that information with you. So that may be a stage where we will go in the future, but that's not happening right now. So there may be some repetitive questions that might come as a result of the conversation that they are having with a Health Navigator when they make the call to you. So I want to make sure that people understand, and we don't get any of the information from those calls back to us either. There is no two-way information. Would that be very helpful or potentially helpful in the future for a subscriber to this service? Potentially. We'll have to take a look at those kinds of things and ask as people engage with us in signing on to this service, and we understand a little bit more about their experiences. So I just want to make that one absolutely clear, because I'm sure there will be calls where it's, well, why can't you access my health information? MedicAlert has it all. And we'd love to be able to get there, because I think that, again, means speed to understanding and knowledge and help becomes a little bit more simplified, if you will, in the process of helping somebody navigate the healthcare system. But we talked a little bit about the experience that somebody might have, and it is a phone call. We're talking to a live human being at the other end of the phone. Are there web calls that happen, or is it just telephone based? What other things, like you talked about packages going out, so there's email exchanges. What are all the touch points effectively that people will have if they choose to opt into the service?
So there's three main things. So one is there is an online platform that members can access, and so there's some, I'll say, self-serve type of encourage that we want to have a conversation with them, especially when it gets into the more complex things, because number one, context is important. You sort of don't know what you don't know, and so it's really important to have that really guided conversation. It is a phone-based conversation. We've just found that is the most accessible way to do it. We don't run into challenges from technology and different things. Generally speaking, whether it's somebody has a mobile phone or somebody has a good old-fashioned landline, they can have a conversation, and it allows our team to, again, ask some different questions. And rather than a chat-based or a text-based, understand some of the nuance of what that person's sharing. I think conversationally, our team can pick up on different things that maybe is important because that person's putting inflection on it or whatever it may be, that sometimes in chat and text can be lost. Mm-hmm. When we move beyond that conversation, as I talked about a few minutes ago, which can range from a few 10 minutes to an hour or more, afterwards, we are almost always providing some information back to the person. If they do have email, it's generally through email. It doesn't contain specific health information related to you. So it's not that we're transmitting, your lab results or things like that. It's more information based in terms of here's what a background is, here's what a definition, here are various resources, here are how to access things. So that from a privacy perspective, that we're not risking anything if somebody happened to open it accidentally or something like that within the household. There are rare situations where somebody may not have access to an email, and that's okay. We have done mailed out packages in the past. In the old days, we did faxed out packages and things like that. I would say most commonly it's emailed, and there's probably a couple of percent every year that we still do mail out or courier package out, depending on how big and how size I said, it's not a single one-time use. So if an individual's health situation is evolving, they can always engage our team, and there is some continuity in terms of who that individual is talking to, who, if there's some information that we have, making sure that we're trying not to ask a lot of the same questions again. Sometimes we have to ask for clarity's sake, or to make sure if something's changed that we really understand what that is. But it's important to say that it's not meant as just a single conversation. This is a resource that is there to those that have access to it, for when they need. And that need is going to change, is going to evolve, or may happen on multiple occasions depending on what's going on with them. I'd say the other thing to understand is it's not just about you as the individual. So while that is a big portion of the support that we provide, sometimes it's on behalf of. So if you are a caregiver, by way of example, which is a common reason why somebody engages with us, whether that's a parent or whether that's a caregiver of somebody who has some medical challenges, or the elderly, or a combination thereof, there are supports that we can provide in both cases, not just to the individual, but also to that family member, so that they can get good information, they can understand, what's needed, how they can support, understand what's going on with that individual, and then ultimately make better decisions.
Yeah, I think that's a really helpful context for people on the call to understand. It's not just, you don't have to be the patient. You can be the caregiver. You can be both the patient and the caregiver, depending on your family's need. Many times we'll see in our member base, we have many families. We've got health conditions that are generational in nature, and different individuals are at different stages. Diabetes is a great example of that. Part of this is being able to knit all of this together for people. Do you have families that often come through, and what does that service look like versus somebody who's just maybe like me applying as an individual? Is there a difference between how you kind of navigate those situations?
I mean, absolutely, there's difference, just because there's we need to understand who we're talking to, what is their relationship, what they're trying to find out. But as I've said all along, and sorry to keep giving the same answer, it really depends on what the individual is going through, what that family's going through, and what that person's responsibility is within that. So it's the same or very similar conversation that we're having, which is try to understand who they are, doing so in a really caring, compassionate way, understand what they're trying to, like, what does success look like? What are they trying to do? What are they trying to understand? And then start to fill in the gaps in terms of really building. It's almost like solving a puzzle. Sometimes we have a really good picture of what's going on, what's available in terms of all the different data that's there. And sometimes we may only have a piece or two. And so our team is really starting to ask questions and try to get as many pieces of that puzzle that they can, so that they can have a much better, a picture to provide back to that individual. But it goes the same for families or for individuals. The conversation may be slightly different, but at the end of the day, it is a very similar experience in terms of work.
So you and I are inherently biased. I'm just going to say that right out of the gate. But is health system navigation something that everyone should actually consider, or are there times where it's really just not appropriate?
I mean, I would love to say it should be for all. And I think if you look at taking a step back, why isn't this publicly funded, or, are these things available publicly? And there are publicly available navigators in some instances. I think the challenge, going back to how our health system is set up, oftentimes those individuals are attached to a component of the healthcare system. So for example, you may have access to a navigation service, or a person who can act as a navigator if you've been in a hospital. Well, that's a very specific type of health situation. So not everybody may have access to that. Or again, regional variations or variations within the provinces. I think There's been lots of documentation, made available over the years of the importance of a role of a navigation or an advocate can play. I think just given the complexity of the health system, it's not entirely clear where it fits. And so that's where we do fit in for the time being, is we're here to provide a service. And so I think, to be more specific on your question of, is there, can everybody benefit? I think they can. Is there certain individuals that have exceptional knowledge about the healthcare system and know every which way to go, and maybe they won't have as much value, but even still, they may get something out of it because they may not have an appreciation for a certain aspect, or it may be that sort of that individual taking a step back and allowing for those difficult questions or difficult answers or things like that. And so, I think it can be, it's a service that could be utilized by everyone, again, for simple reasons like finding resources or understanding, what something means, to much more complicated things like, I have, an elderly parent who had a fall, and now I have to organize care to support that individual, and so on and so forth, and sort of everything.
So it does become complex, and health changes decade over decade over decade for individuals. I'm a living example of that as a 40+ year subscriber to MedicAlert. My life has changed dramatically over those 4 decades that I've been a subscriber, and my engraving on the back of my ID gets longer and longer. But part of this is MedicAlert's mission is to provide high quality health information at a time of need. We've often described that in the moment where people are having a crisis and the ambulance has to be called, or something of that nature. But really, health information is as important in the prevention stage or the management stage versus the crisis stage. And that's one of the reasons why we're looking as an organization to evolve in terms of the services that we provide. And arming arming our subscribers and our members with information maybe might help them avoid the moment where they have to call 911. And that would be a remarkable thing that we could help and support, because the information flow isn't to the first responder in this case. The information flows actually to the person who's managing their healthcare condition. And I recall, Jamie, when we first started talking last year, and I was talking about this around the table with our staff, I had one of my team members say, he and his wife had just had their first baby. And that baby was a COVID baby, and that whole experience of sort of starting daycare after being isolated was challenging. The baby was sick all the time. And he said, "Is this normal? I don't even know if this is normal or not. I wish I had somebody that I could have actually talked to about this, because the doctors didn't seem that concerned, but I was really concerned." So I know there are stories out there like that dad who was really concerned and would have welcomed the opportunity to have access to that information. What other stories do you have that you can share? Not actual stories, obviously, but stories about the kinds of impacts that people have had by using a navigation service that might help our audience understand a little bit more about the kinds of folks who come and benefit from the service.
So I think, I can give sort of 3 examples. I think the common one I talked about briefly before, which is, I need a healthcare professional.
Mm-hmm.
And that's a different conversation that tends to be somewhat proactive. The individual is looking to get connected with, maybe they've just moved into a new area, or maybe their primary care doctor retired, or whatever may be driving that. At times, it's a disguised question. Something's going on with the individual from a health perspective. They don't have a resource, so that's the real reason that they're calling. We start to uncover what's going on with them, and it allows us to be connected with that individual as they, get to have some clarity in terms of getting test results and things like that. Another example is where an individual has a particular health concern or a diagnosis or something that's going on with them. It tends to be newer things, or changes within a health status. And so a great example that I can give is somebody who has been recently diagnosed with diabetes, or has been notified that they're pre-diabetic and they want to start taking action to get a better handle on their health, understand what decisions they can start to make to try to impact, what options are available, all those sorts of things. And so in that instance, our navigation team actually provides two roles in that type of situation. So one is the role that we've been talking about all along, which is navigation and sort of that that information-based resource. The second is we do some health coaching with the individual. And so health coaching is a little bit different. If you think of navigation is about providing information and providing the individual with a bit of a roadmap, coaching is more goal-driven. So if in the instance of a pre-diabetic, they want to ensure that their blood sugar is in control so that they don't tilt towards diabetes, that nurse can work with that individual to really set up a goal and then start to manage against that goal. That is going to be specific to whatever that situation that individual is going to, and tends to be over a period of time as they're providing some information, providing some education, and checking back from an accountability standpoint to help that individual. And then I think the most complicated thing, or some of the most complicated thing is one that I just spoke about a minute ago, which is a caregiving situation where, a great example is my mom had a fall and was living independently and, was maybe briefly hospitalized, and now is being told, they can't, it's not safe for her to be at home alone. And so, our team spins into a bunch of different information, really outlining what's possibilities for that person. That's about educating the individual around, how does the healthcare system work? How does home care work? How does long-term care versus retirement versus assisted living? What are the different nuances? What does it cost? Because those, in many instances, aren't entirely covered services. How do you access different funding for those? What are the first steps along the way? What's the process involved with it? And so on and so forth, and start to build up a plan for the individual in terms of managing through that. And so that tends to be, again, less episodic because we're helping the person as they're getting more clarity around timing to get home and the kinds of things that person may need, and so on and so forth. So I think those are three examples on the continuum of where we provide a lot of value. That's not an exclusive list. We do everything from, as I said, very basic things to really complicated, but hopefully that gives a bit of a few different examples of some things that we can really help with.
That's really great, Jamie. That you touched on health coaching, which was one of the things I did want to ask you about, because not everybody has ever had access to somebody that can help keep them accountable on their healthcare journey. In fact, sometimes the relationships and families can make that challenging to actually achieve. I am recently diagnosed as a type 2 diabetic. I would have loved to have had a coach along the way in terms of making me more accountable before I reached that point. Now I'm managing to get my A1C under control, and but just having somebody as a touch point along the way, I think is really, really helpful. And that's where sort of looking at the service from a long-term perspective, because oftentimes we think about questions as acute things in the moment. I only need this once. Whereas health coaching is something, if you really want to talk about weight management, I mean, the big conversation around all of the new drugs out there, I'm sure there are lots of questions that come into the team about what shouldn't I, is this appropriate? Why can't I get access to this? All of those kinds of things around those new introductory drugs into the marketplace. So health coaching, I think, is really important. The complexity of caring for a loved one, or you might be doing it from a distance. Our Safe and Found program is a really great example of that for people who wander and those who have Alzheimer's or dementia. Oftentimes we find that the caregiver is living in a completely different city when the first wandering instance happens, and how to navigate that because that's not a one-time, one-shot deal at all. It is really a very complex process that changes over time with the progression of that particular set of diseases, because it's not just one. So what other sort of maybe or hidden places would health system navigation become helpful for a family, for example, or a caregiver, for example, things that people might not necessarily think about?
Hmm. I mean, I think there's the two aspects. So I think coaching is one where we can provide that resource that individuals, may not consider. And that doesn't necessarily have to be tied to a particular illness. So, what we've been talking about all along the way tends to be more event driven, where an individual, um, you know, needs to understand something that's going on with their health. Um, Coaching can provide a different role, from being a little bit more proactive or maybe preventative in terms of some of the things that we're able to do. So our team does, while we help with individuals that have been newly diagnosed with diabetes or pre-diabetic in terms of managing that, we also move to more sort of lifestyle concern, which is, I want to quit smoking. I mean, a great stat I just saw is lung cancer is at its lowest levels in the last decade, I think, which is amazing to see. But we still have lots of individuals who may want to stop, who may be smoking. That's a great service where we can help with. I want to sleep better. There's lots of great things that we can do from a coaching perspective in that. I think one thing that we haven't really talked about is mental health and mental well-being, and skills around understanding and providing support to individuals that are going through that, whether that's identifying different resources that they may have or providing coaching around stress reduction and things. There's lots of different aspects where we can really help in a lot of ways that maybe people don't always think about.
So, and to get it from a single place,
Yeah.
it is actually quite remarkable. When you look at, I mean, we're all bombarded every day by various aspects of health coaching or mental health, and it's individual components of that. And if you happen to be an individual who has all of those things that they want to help and manage in their life, it's a lot easier to come to one place than it is to go to multiple places. And that's where we're excited to be working with you. You mentioned earlier on in the conversation about Health Hub, which is actually the service that we provide as part of the regular MedicAlert subscription, that self-service piece where you can go in and dig around if you like to do research and understand things as well, but then augmenting it with the Health Navigator when you really aren't necessarily either getting to what you're looking for or understanding what it is that you're reading. That extra layer can be particularly helpful. So it's not just about, I have an illness, I need an answer. It's I'm a human being. I want to be healthy. I want to improve my health status. How do I go about doing all of those things? That, I think, is the real benefit and the value of Health Navigator. So Jamie, I want to thank you so much for joining me today to help people to begin to understand what the Health Navigator is all about. Your team is incredible. The services that you provide are incredible. And I know our members who have already taken advantage of this service are finding that that is the case. The feedback has been really, really positive around this. So what I'd like to do today is for those of you who are on our call today or who have registered but maybe looking at this in the video format a little bit later when we actually we send it to you, is that if you are considering health system navigation, I would strongly encourage you to sign up for the Navigator service, and we will give you a code or a coupon for you to go online and get $5 off the subscription. So hopefully that's an encouragement for you to join, but really and truly, this is a valuable service. It's not available directly anywhere else. It is only available through MedicAlert. You can't get this by just calling Jamie and saying, hey, can I do this? So I think it's really important for you to consider this. We want to make sure that everybody's taken care of and is safe, no matter where they are in their healthcare journey. So Jamie, again, my thanks. It's been a pleasure, and I'm sure we'll talk again soon.